Okay, I got you.
This or
No,
this?
no.
Okay, show us. Oh, wow. Okay. I can't believe both
Big.
of us were off.
Don't touch.
Maybe, who was it? I think that's two.
Two?
Too close. Yeah.
I don't like the table.
Like right there is fine.
Okay.
I think. Alright, let me make sure. I'm not
Maybe we
if
should
we're
have had a
live right now,
purple
but-
tablecloth
Oh, we
or
are?
something.
Okay.
But I just want to make sure it's working.
All right, Kayla, you ready?
No.
Yeah. Sorry, guys. I know we're new to the
I
podcast
think we're
world,
good.
so. Oh, awesome. Okay. So we were having some technical difficulties, but that's all over.
Good, right?
Yeah, it's great. Awesome.
Perfect.
Cool. Only 2 minutes late, SFWM. We get better every time. Okay.
Alright, so introduce yourself. Sorry.
Yep.
Sorry for technical difficulties.
All right. So we're going to get started.
Go ahead.
All right. So welcome to Talking Wellness. It's our new podcast, South Florida Wellness Network, and really excited today. Today is a powerful day. It's International Overdose Awareness Day, and I have two just extremely inspiring, hope-giving, compassionate, incredible humans to the right and to the left of me that I actually know personally, and I've asked them and invited them on this podcast this morning so that they can give a little bit of their experience, strength, and hope as it relates to overdose awareness. So before I introduce them, I just wanted to give you guys a little bit of statistics just to kind of talk about the importance of bringing awareness to overdose. As we all know that we are in a opiate epidemic. And we are losing people every single day. Lives are lost. These are daughters, sons, brothers, sisters, friends, people that are productive individuals in the workforce. And so overdose and substance use disorder does not discriminate. And today is really about, one, how do we bring awareness? How do we help individuals that are struggling? And how do we prevent overdoses? People do not need to die. And we want people to know that they don't need to fight alone, but also to just remember those that we've lost, just incredible people. And so today that's kind of what we're going to talk about. I just want to let you guys know that more than 1 million people have died since 1999 from a drug overdose. That's 1 million lives lost since 1999. And the number of reported drug overdose deaths that occurred in the United States in 2022 is over 107,000 lives. Okay, and the year before in 2021, it was over 106,000. And these are just reported in the United States alone. So obviously we know that this is a global thing that's affecting people all across the world, and how do we rise together? So I have my two friends with me to the right and to the left of me. I'm gonna allow you guys to each introduce yourself and just share a little bit about your personal journey and experiences as it relates to overdose. We can start with JP, John.
Sure.
Yeah.
Yeah, so my name's JP, and I am a person in long-term recovery. And I happen to work at South Florida Wellness Network as I'm the specialty program supervisor, and I'm also a certified recovery peer specialist. And thank you for having me today, Kayla.
Awesome. Thanks, JP.
Hi, guys. My name is Jessica Vasquez, and I also work with South Florida Wellness Network, and I am the lead peer specialist with the Family CPR Department, which works with the child welfare system in conjunction with ChildNet and the court system to fight the stigma and advocate and support those parents who are struggling with substance use disorder and mental health.
Awesome. Thank you, guys. And I'm Kayla Calafieri. I am your host for today, Talkin' Wellness. I also work at South Florida Wellness Network, and just really grateful and honored to be here with you all today and to be here with you guys. So as we get started, I kind of just wanted to open it up and kind of give you a space. I'll ask you first, JP, just to share your experience with overdose and how it's impacted your life and your journey and even your recovery.
Sure. I experienced my overdose quite a while back. before it was really a thing like it is today. Sorry. And it occurred in 2008. And it was due to mixing prescription medication that was prescribed to me. I had taken a little too much of both Xanax and Oxy, and I had used it in a way that I had never used Oxys before, right? And so I had used it intravenously for the first time ever, and given the two types of medications and the way I did it, it took me out. I don't remember anything. From the after I did it, I just took the tie off of my arm, and was sitting around kind of waiting for something to happen. And then next thing I know, I wake up on a gurney being pushed into the hospital. And my initial reaction was that, I asked the EMT if my car was okay. And he's like, I don't know anything about your car. You OD'd. We Narcaned you. And then my next reaction was to frantically check my pockets to look for my stuff, and it was gone.
Wow.
Yeah.
Wow.
So.
Wow. That's scary. Just even to wake up and really not know what happened, and even the term. What does the term Narcan mean? For those that don't know, like what Narcan is, can you kind of explain what Narcan is? And
yeah. So at the time I had no idea what Narcan was, but now I know that it is a opiate reversal medication. So it actually it will counteract the opiate and how it's affecting your brain, and kind of give you a moment to kind of recover and start breathing again. So it's temporary, but it works.
Yeah. So you pretty much died, and that by the officer that used Narcan, or was it EMT?
EMTs, yeah.
It brought you back to life.
It did. Yeah.
So when you came back and when you came to, like, what was that experience like? And because opiates are so addictive, and there's like that psychological and that physical dependence. And so, like, what is it like for those that don't know what it's like to come back from an overdose, and kind of what was going on through your mind?
Yeah. So like I said, my next reaction was to look for my pills, because I was extremely sick. I was having the chills all over my body. I felt like I was burning up. I was nauseous. I ended up, when they got me into the room, I pulled out all the IVs and signed myself out of the hospital immediately, because I realized that my medication was gone, and I knew where it was, and I was sick. And so I was hell-bent on trying to get back to where I knew my drugs were.
Just to feel better.
To feel better. Yeah.
Wow. Yeah. Thank you, JP.
Yep.
Jess, what about you? What was your experience?
So my experience with Overdose was back in December of 2017. Fentanyl was just starting really to become popular at that time, and I knew that I was using fentanyl. I just didn't care, because I just didn't want to be sick, and that's what was out there at the time. When I overdosed, I was also an IV drug user, and as I felt it going through my body, like, I remember telling myself, like, Jess, you have to breathe, because I couldn't, like, it's almost like an outer body experience, because I remember telling myself to breathe, and I would try, and then everything just went dark. I was told that I was Narcan 6 times. And I remember coming to from one of them, and I heard the paramedic say the drug is winning. It's not strong enough. And then I went back out. And when they transported me to the hospital, I was in Miami, and they ended up putting me on a Narcan drip. and I was sick. I was so sick, and I stayed there for, I don't know, maybe 10 hours or so, and as soon as I was okay enough to like walk, I signed myself out, and I went back to get more because I just had to do less. And I knew that, I mean, the insanity of thinking about it now, it's like, well, that meant that it was good. I just had to do less. And I mean, Narcan saved my life. I wouldn't be here without it. So I'm grateful for the EMTs that actually responded that day. And I'm grateful to whoever that bystander was on that sidewalk that day that actually called 911. Because if it wasn't for them, I wouldn't be here.
Wow. So would you guys say that citizens and people that even maybe aren't, don't use substances themselves, that it would be like really important for them to kind of understand the importance of Narcan, to carry Narcan?
Yes.
Because it sounds to me like if it wasn't for somebody's intervention and calling and even knowing a little bit about maybe substance use and, the opioid epidemic that we're in, you might not be here.
Right.
Yeah.
It's
definitely.
very important.
Awesome. So I have a question for you, JP.
Sure.
Overdose is often associated with stigma.
Mm-hmm.
How have you encountered or dealt with stigma related to overdose and substance use?
Well, I've being that now in my recovery and in my role in what I do in the community and responding to overdose calls, I've seen it in hospital settings where attending ER physicians will walk into the room and ask me what I'm there for as I'm talking to the patient, and I'm being respectful and asking if he needs the room to talk to the patient. And, he takes me outside and he says, this was a fentanyl overdose. And I was like, yeah, I'm aware, and we're trying to see what we can do to get them some help. And he's like, if it were up to me, they should just let people do whatever they want. And if they die, then it's on them. And this is an ER doctor.
Wow.
And so right there, the burnout and the stigma and seeing it time and time again in their emergency rooms, it's front and center.
Yeah. Well,
every day.
what is your response to that? I mean, there's a million things going through my
Right.
mind right now. Like, first of all, that's somebody's son, that's somebody's child, that's a brother, that's, maybe that's a father. Like, how could we even say that about, a human being, the precious life of somebody?
Yeah, my response to the doctor was, well, I'm a person in recovery, and I was one of those people, and and now I give back to help others.
Yeah.
And he's like, well, you got your work cut out for you, and he walked away. And and I continue to show up, and I continue to be a light, for those that are out there struggling, and let them know that this is possible. And for anybody who has any feelings otherwise that recovery isn't possible, that I can continue to be that beacon, to show people that it is possible, and
Awesome. So Jessica, this question's for you. For those that may be struggling, supporting someone who is struggling, what advice would you give to somebody that's either seeking help or somebody that's seeking help to provide support to a loved one?
So someone who's seeking help, pick up the phone. For someone who's seeking to support someone, educate yourself. I think that finding support groups like possibly Al-Anon or like CODA or something like that, or an RCO that has family, the Federation of Families, like we do.
What is an RCO?
A recovery community organization that provides support for the community, and just get support for the person who is supporting the individual, and the individual to seek out help and just educate themselves on different recovery pathways, and know that there's a possibility out there of living a different life. It doesn't have to be so cut and dry. There's different ways to be in recovery, and just know that it's possible.
Yeah, that's awesome. I think too is most often people don't understand that substance use disorder is kind of the drug use is merely the surface level, the symptom, maybe like the behavior
solution
that people see, right? Because ultimately we're trying to cope in life, and we pick up different tools, right? And opioids are extremely addictive, and there's actually like it's a physical addiction, and that's why we even see like where there was the with the Oxycontin, and now we're hearing all about the opioid settlement funds, because a lot of people ended up becoming addicted to opioids through means of falling and hurting themselves, getting prescribed, and then becoming just extremely addicted.
Yep.
And I think that was your story.
Yeah, that was my story. I fell off of a roof, was in the hospital, had a severe back injury, got introduced to a pain clinic, and back then it was just the wild, wild west. Everybody was prescribing them. That was the thing. And I remember when I ran out, and it had been about 3 months since I had hurt myself, and thought, okay, well, maybe I don't need to go to the doctor this time, because it was expensive. It wasn't cheap. And I think I went probably about 48 hours. And I was like, oh, my God. I had no idea what was going on with me. And I actually went to my primary doctor because I thought I had the flu, and I had no fever or anything like that, but I had all these symptoms. And he's like, well, I noticed you were taking some high prescription opiates. When's the last time you took one? And I was like, well, I stopped going to the pain clinic. He's like, oh, well, you're in for a ride. It's going to be like this for about a week. And I was like, I can't do this. I got to go to work.
Yeah.
So I went back to the pain clinic, and I stayed stuck, for a long time.
I can actually relate to that too, because when I was going through my substance use and I began using opioids, I did not realize, I had no idea that there was this thing called withdrawal, and I was going to feel sick. And so I literally thought that I was like dying sick with the flu.
Yeah.
And so it's the craziest thing, but I literally went through that experience and didn't know that my sickness was actually being caused because I did not have these pills, to continue that use. So it's I think people don't really understand, substance use, and I don't think that they even understand like the impact of opioids and how hard it is for individuals to actually just, to stop once they're started, amongst the many other complexities that individuals go through that they're coping with in life. And so what are some tools and strategies and resources that, you guys feel really helped you through your recovery journey? And
Prayer.
So many.
Prayer every night. When I finally put it down, and I really gave this thing a wholehearted shot, right? It was every night, even through the withdrawals. Out there, I remember gripping the railing of the balcony at the apartment complex that I lived at and looking up at the stars and just asking God, please carry me through this. Please make this go away. I can't go back to this life anymore. And I did that religiously because I couldn't sleep. So I was up all night, smoking lots of cigarettes, praying to God, just to get me through this. And I believed that he could, because it was the only thing that I had at the time, and
what were some steps like, so you prayed this prayer, but then like what happened after that? Like what were some of the key components to, where you are today?
Support from others.
Okay.
Being surrounded by other people that had been there, that knew what I was going through. you know, even with like the physical remedies of things that I could do to kind of stop the restless legs and taking hot showers and just,
Restless leg.
yeah,
It's a nightmare.
you know, yeah, support from others was huge, you know, getting connected with other people in recovery. Because I had never tried that before. I would always, I would just go home,
Yeah.
you know, and not surround myself with anybody else but myself,
Yeah.
you know, and so that was not a safe place to be. But, and then, so with faith, support, um, you know, the compassion and understanding of what I was going through and allowing me to heal, I think was huge. When it came to the community that I got involved in right after getting out of treatment, like they understood. They gave me a week to rest up. You know, I wasn't allowed to leave the property. You know, I was there to attend meetings, you know, and stay there that whole time. And so that grace that I was given, I didn't have to rush right out and get to work and look for a job or anything like that. Gave me that ability to kind of get myself grounded,
Yeah.
you know.
Yeah. And I think there's a lot of resources out there for support, because I think sometimes it's hard to even grasp, like, when you're out there and you're alone and you feel so alone, and like maybe you've kind of drove out every relationship in your life. And then also, I mean, even for me, like I remember just feeling so ashamed, like so ashamed to even ask for help. Like I truly just felt like I was so alone. And so, you know, Jessica, what was it like for you in that kind of time where you maybe transitioned into your recovery process, and what were some of the things that helped
So my transition into recovery, the last day that I remember living in that part of my life, that chapter, I remember the night before I prayed and I asked God to help me because I didn't want to live that way anymore. Little did I know that the events that took place the next day were going to completely remove me. God has a sense of humor, right? So you make plans and he laughs at them. But I didn't want to go back to treatment. I didn't want to go to take another medication when I was already experiencing a dependence on a substance. So I cold turkeyed for days off of fentanyl. I mean, it took over a week, and I remember laying on that floor. I remember not being able to eat barely every time the food got near me, or my dad tried to make me soup one time and I just pushed the plate away and ran to the bathroom because I couldn't even smell food. I was so sick. And the restless leg and not being able to sleep, and every time I closed my eyes I was thinking about going back out, and then the pain, and it was difficult. But I mean, prayed. I had my support from my family was huge. And believe it or not, the support from my child net case manager at the time was a lot. Yeah. She didn't give up. And it was different because I had other case managers on my case that didn't show that empathy, and they didn't show that compassion and understanding. She did. She called, she checked up on me. She came by to see me. You know, she would give me these little motivational speeches and, like, you know, go out, go, you know, call somebody, find someone. And I did. I went to a meeting, raised my hand, you know, and found the support of a group of people that understood me. And for the first time, I felt like I belonged somewhere, because I always felt like an outcast. So I allowed people to love me back to health.
Yeah.
And like, believe in me, because I felt ashamed. I didn't want to ask for help. This was like my 13th detox.
Yeah.
It was like I felt ashamed because everybody kept saying, well, when are you going to get it right? Why can't you just stop? You know, don't you love your kids? And I adore my children, but they couldn't keep me from using. It was my solution, and I didn't realize that the trauma that I had dealt with in the past is what had me using that to cope, to numb, so I wouldn't have to feel the pain instead of just healing from the wounds that made me do that.
Yeah, for sure. And I think, you know, I always say this, I don't think anybody, you know, picks up their first substance or tries, you know, a drug for the first time to say, hey, you know, in 10 years, I want to go through hell and back. I want to lose custody of my children. I want to be, you know, experiencing homelessness, pain and suffering, relationships broken. Like, nobody actually like wants that for them, for their life,
Right.
you know, and because I too, as somebody in recovery, I've gone through these things, you know, I've gone through incarceration, losing custody of my child, have gone through the loss of relationships, being completely alone and ashamed and all of these things, and yet still using this tool, you know, and there's such a stigma around drug users. And, you know, one thing that you said that really caught my attention is like your child networker, right? Like was somebody who showed empathy and compassion, and when she could have looked at you and all of these things, right? Like looking at your behaviors and defining you as those things, but it's never the case.
Right.
You know, and I had a probation officer, and that was like my beacon of hope and the light in my life at my darkest hours, who I would have never expected to kind of look at me and be like, you know, I believe in you at this moment where you've like literally broken law and probation. You're absolutely high in my office, and you drove here without a license, and I could literally put you in jail right now. But
Right.
I just want to have a conversation because there's actually this concern that I have for this 20-something-year-old girl that's sitting across my table, who I can just look and see is lost and is hurting and is just broken, you know, in a sense, and breaking, you know, and falling apart. And so it's like, that's where it's like, how do we tell the world, like, you know, the stigma that they have towards drug users is actually creating more of the problem,
It is.
you
Yeah.
know?
Yeah, because that's what that's what ultimately ends up forcing people to die in a gas station bathroom, you know, alone, because they don't want nobody to know, you know, that they're full of shame about what they're doing in secrecy, you know, and that's one of the biggest dangers of people that use opiates or fentanyl.
Yeah.
You know,
And
is-
alcohol, and there's other drugs that
Yep.
people are also overdosing from. You know, I
Sure.
lost my aunt a couple years ago, and it wasn't an opioid overdose, but it was another, you know, substance.
Yeah.
And it's just, and you know what? She died in a hotel room by herself, and it's just, it's a sad thing, and I think it impacts so many people. But like, you know, when I think about my aunt, like, she was a beautiful person, you know, and I don't, this is what she struggled with, you know, unfortunately here on earth. But, you know, I just think of like how we can do better at every level. You know, how do we really have recovery ready communities, from like the child advocates to the school teacher to, you know, the person that's checking you out at the supermarket, like to really just be aware and to be kind and to, you know, carry naloxone, right? Because, you know, people are dying in gas stations, they're dying in hotel rooms, they're dying in clubs, in bars, they're dying everywhere, you know, and you have this life-saving tool, which people stigmatize as well, because they're like, oh, I don't do drugs, you know, oh, I don't need that, or, you know, all this stuff, but like you can literally save somebody's life.
And people have a misconception that Narcan is enabling use, right? I've heard that a lot doing the street outreach with JP before, and it's not enabling use. What it's doing is saving a life, because let's just face it, people are gonna use no matter what.
Yeah.
Right? And just realizing that harm reduction is a pathway to recovery. It opens the door, and it opens the possibility for an individual to feel welcomed and not judged, and be able to pick up that phone and reach out for help.
Yeah.
And I've also, during outreach, times that we've gone out there, people are like, well, I don't do that,
Yeah.
so I don't need it.
Right.
But it's everywhere.
It is. Yeah.
It's everywhere. You don't have to do opiates. You don't have to be an IV drug user, because I've also been approached with the stigma of, well, you don't look like an IV drug user. And I'm like, well, I don't know what that's supposed to look like.
What does that even look like, you know? And I agree. I think that like society shapes this image of what, you know, a drug addict looks like and their behaviors of a drug addict. And immediately it's like you're either good or you're bad.
Right. And substance use disorder isn't a moral failing.
It's not.
It's a disease, just like diabetes, just like blood pressure. I mean, I use it all the time. I say it either with like blood pressure meds or diabetes. You wouldn't judge someone for being diabetic and not taking their insulin and then going into a diabetic emergency or a diabetic coma. And we use it too in the court system. I mean, it's surprising that at this day and age, there's still so much stigma out there against substance use disorder. And it's sad, really.
It is. I agree. And I, you know, and I don't want to end there, because I do think that like there's a lot of good strides that we've taken in the recovery movement, and like to do things like collaborate with Broward Sheriff's Office to, you know, be able to engage individuals rather than taking them to jail, just to see if they want help, you know. And I think that even the more that individuals in recovery speak out, and that we go out and we bring awareness and we talk about the hope and we talk about the misconceptions with substance use, we create a new visual, we create a new image and vision for recovery, and even recovery-ready communities. And that recovery is, one, it's for everyone, but that it really takes all counterparts of a community to make it happen, right? Like from every level.
Yeah, there's got to be buy-in all the way around. You know, and I think has been amazing from just the short time that I've been in recovery to see the change that's happened within, you know, within the police department at the Broward Sheriff's Office, and understanding that these individuals need help. They don't need to be, they can't arrest away the problem. I've talked to countless deputies who know that doesn't work. You know, they arrest somebody, they see them right back out there doing the same thing 4 days later. You know, and so they're bought in. You know, they're trying to offer help when it's when the individual is willing, because they know that too, is that, you know, it can't, you know, recovery can't be forced upon somebody. They gotta want it. You know, and so they do a pretty good job of you know, asking the individual, is this something that you're looking for? You know, is this something you want? You know, and they'll connect them with us, and we're able to support them in that journey, and it's huge.
Would you say that the change that you've seen, what would you say is the biggest reason or cause behind this change that you've seen in police officers and how they even are encountering or engaging individuals who use drugs?
Well, from the top down, you know, that they see how it's impacting their communities. They're seeing it's impacting them personally. You know, I think substance use touches everyone. You know, like they say, it doesn't discriminate. And you know what they've been doing isn't working. You know, and so you know, they're looking outside of, you know, the laws and how they can serve and what's available in the community to be able to help these individuals that live within it. And I think that's been the big thing, that, you know, the numbers of people that were dying before the, you know, it was just staggering. You know?
I'm gonna say peer support too. Having all of us out there advocating and educating the communities. I mean, the judges are buying in, the lawyers are buying in the dependency system. I mean, out there with the, between the CIT, the critical intensive, what is it? Wait, I just had
Wait.
Crisis
moment.
intervention.
Crisis
team.
intervention
Yeah.
training. and the outreach and just knowing that the education out there now is different, and people are starting to shift.
Yeah.
It's slow, but it's starting to shift.
Yeah, I agree, and I think that communities, I see it in communities at a community level. I'd like to see it more at like a legislation and like, policy, when we really look at how policies are being created. I know that what's amazing, a huge accomplishment that was driven by a lot of the recovery movement and people showing up to Tallahassee is the fentanyl testing strips being legalized in Florida. Like, this is such a huge tool so that people can, check their supply before they get high. And it was illegal. It was considered paraphernalia. And just the push to get that passed has been like a huge achievement.
It has. Yeah, because now that, you don't know how many times I've heard where a person had, they just went and bought a $20 crack rock and took one hit and woke up in the hospital, and that the drug supply is tainted, whether it's knowingly or unknowingly, but it's a real thing. I mean, countless stories, that somebody took a Percocet, looked like a Percocet, bought it off somebody off the street. Next thing they know, they're waking up in the hospital. And so it's being able to distribute those out there when we're doing our outreach, and it's a great conversation starter to be able to hand out those fentanyl test strips and start the conversation with somebody about how to use safely. And they're open to talk to you because you know what it is that they're doing and you care. And you're providing them with some education, so that way they can use safely, and let them know that when they're ready, recovery, if you want to, learn more about it, hit me up, and they feel more apt to engage with you versus somebody who's trying to shame them into recovery.
I can't stand that. Yeah. It's like, take this, and just, I mean, this is my advice to myself is always like, even because I have a child, I'm a mom, and I also work in the field, and I'm constantly talking to just different individuals at different stages in their life and in their journey. Is just like being curious, being open-minded and coming just from a place of just like love and caring and compassion to just understand, like seek to understand. We know that drugs are dangerous. Yes, we know that these are the risks that these individuals are taking, but they know that too, So it's like, yes, this is already a thing. And how do we engage people in a way that lets them know, like, we care, you don't have to fight this alone. And it is a journey and a process.
A lot of what I've come to learn is that not putting expectations on what somebody should, what somebody's recovery should look like.
Right. That's good.
Has been able to personally help me recognize that it's not my recovery, right? And then it allows me to be more open and receptive to individuals who may not just, they may not be there at that moment. It's, that their recovery looks a little bit different, and when I remove my expectations on myself for somebody else, then it allows me to not impose that stigma or that judgment or anything.
And that's hard
like that.
Sometimes as a human, right? It is. It's hard. It's not like you're going to always be perfect at that, but it's being able to have that self-awareness, because a lot of the time there's either this like fear-based approach or this like people think they're being helpful, but it's like be on the receiving side of what what you're saying and stuff. And so it's just kind of thinking through how we support people. Jess, I have a question for you. What are your hopes for the future regarding overdose awareness, support, and prevention?
I mean, realistically, my hopes would be that there wouldn't be any at all, right? Unfortunately, that may never happen, but just having the community, everyone in the community out there, educated and ready to help, whether you have substance use or not. in the schools, these kids, I have teenage kids, and my house is always full of teenagers, and I'm constantly talking to them and hearing what's new out there, because you know, we're not in the schools, and we don't really know what's going on. Oh, at least me, right?
Yeah.
Don't really know exactly what's going on in the schools, and just getting the feedback from the kids, and they're proud, and they tell their friends, right? Oh, talk to my mom. So just having that open communication with the youth, with the people in the community, continuing the strives that we're making with law enforcement and with the court system. I would like to see the stigma broken,
Yeah, for sure.
and understand that this is a disease, that we don't choose to be this way, and just helping everyone that I can in the process.
Yeah, that's good. Yeah, I mean, I really would just like to see recovery be a part of healthcare. Like, this is
Yes.
healthcare, you know, at every level. And you know, the schools, that's like a big one too. And I am seeing like colleges becoming like wanting to educate their students more and things like that. And we get to collaborate with some colleges, you know, which I think is amazing, because we're seeing a lot of you know, that college age students that are dying of overdose poisoning due to fentanyl. And but it's like, I think the question, and I think parents' fear too, is like, how soon do we begin this education, right? Like, maybe my child is too young, and I'll tell you, like, my son is 12, and he is extremely aware of overdose, of substance use disorder, of fentanyl, and of naloxone, Narcan. You know, he knows how to use it, he knows what it's used for, and all of those things, and he wears overdose awareness shirts and can tell you about that. And I think that that's so powerful. And he walks around middle school, you know, and it's like, this is what's going on. Our youth are also being, you know, they're in the world. They're seeing this. They're exposed to these things. And so how soon can we educate and start to kind of give some awareness?
Yeah, it brings me back to thinking about DARE when I was, I think I was in like 5th grade. And we would design our and I'm dating myself, but this was way back, because they were trying to figure out what they wanted for the logo. And so nationwide, they had all the kids in school create their T-shirts and submit them to DARE to see which one would get picked.
Did yours get picked?
No. No, I was only in 5th grade. I had syringes. I don't even know how I knew, but like, I had syringes, razor blades,
Yeah.
you know,
Wow.
you know, and I don't ever remember being exposed to any kind of drug use as a kid growing up. So where I got those images from, you know, to put on that T-shirt.
Yeah.
And that was then, before social media was such a big
Right.
thing. Now kids are exposed to this stuff on social media, on TV, in the music.
For sure. And I think we could break stigma at a young age, you know, because I think sometimes too, like, parents out of fear will create a stigma around drug addicts, you know, just because they don't want their child to use drugs, right? But I think that then carries into their adulthood, and it's these stigmas that are created actually from a pretty young age.
Right, and then I'm going to hide it from my mom.
Yeah.
And then I'm going to die in my bedroom, you know.
Yeah.
And my parents never, you know, and then their parents never knew. Oh
Yeah.
my God, how did this happen to my kid?
Right.
You know.
Yeah. My kid, you
Right.
know, like, how could I, you know, have missed this?
Yeah.
But it's because we're not open to the conversation
Right.
and to the education piece. And we're still focused on this good, bad thing,
Right.
you know? And it's
Right.
like, gosh, we got to get away from that and this punitive approach that people take to substance use, you know, because they don't understand it. And what they see is tragedy sometimes, right? We see deaths. We see people that are acting outside of their character. We see families destroyed. We see, you know, kids that don't have parents and things like that. But, you know, the answer is when we create more shame and more stigma around these things, we don't bring
Hope.
we don't bring hope. We don't bring solution. We don't bring, really all we do is we push people away further. And that's where we go back to people dying alone.
Yeah.
So I wanted to finish up. We're going to be coming to a close, and I have just a question for both of you, as far as, International Overdose Awareness Day and really trying to get this information out to the world. How do you envision positive change taking place from today and on?
Well, I think that, continuing in our mission and in our efforts, as an organization here, a recovery community organization, we're growing. And I think the more awareness that we raise about this issue is going to educate people and on how to respond and react when these situations present themselves, how to have open conversations with their loved ones, with their employees, about substance use, and using language that is, strength-based, that isn't, doesn't come from a place of judgment or shame, and to kind of normalize what recovery is and the process that people have to go through, because this is a journey. It's not linear, right?
Yeah.
That sometimes it ebbs and flows and winds and and things like that, but that this is, a journey, right? And so when people start to understand that and they want to, they continue to walk that journey with them, and as in thinking bigger as a community, that we have to kind of rely on each other to kind of support each other through the hard times, and and celebrate the wins, and I mean, if we were to look at some of the numbers, I believe in the state of Florida, the numbers actually decreased a little bit, a few percentage points,
Wow.
know.
What do you think? Why do you think that it decreased?
I think, being that naloxone is available, statewide, that there's a website that people can go to find a recovery community organization that distributes naloxone for free, making that low barrier access to it has saved a lot of lives, and so I think that that's probably been one of the major factors in the numbers going down. So.
Thank you. What about you, Jess?
Just continuing what we're doing. I think that organizations like ours, not just because I work here, but because I truly believe in the mission of peer support and getting out there and educating the community. And hopefully, like you said, it'll be part of healthcare. And hopefully, I think right now it's starting to make a shift where the higher ups in the government are starting to realize that this has become an issue. It's been an issue now, but they're starting to realize it. And having more funding for the organizations that are out there providing these supports for these individuals, and the education, and possibly getting, like I said, into the schools, and educating the youth and the colleges and everyone on as much as possible.
Yeah. I both of those answers are really good, and I think as a community we need to know where a lot of this opioid settlement funds are going. Like we the people, the voice, the ones that are out there, boots on the ground, seeing what's happening, helping individuals at those low barrier access points, need to be involved in the decision making for the people that are getting the support.
Yeah. Get involved. Get involved. Our voice matters.
Yeah. There's so many ways that you can be involved to support overdose awareness and overdose prevention, because we believe that nobody has to fight alone, and that we can end overdose, but we know that we can't do it alone. So really that's our kind of call to action, is just asking all of you who are here viewing, who may view this later, is, how can you be involved in saving lives? Because we rise together, and we can rise as a community, and we can make the impact. So I just want to thank both of you for being here today, and just for speaking and sharing transparently. And it's just awesome getting to hear from both of you. And I want to thank all of our viewers, and send you guys out there and just, spread the awareness, and find a way to make a difference, because we all can.
Awesome. Thanks,
Yes.
Kayla.
Thank you.